today we're going to be talking about how to look at lamenesses that are in the foot. So if your horse is lame, the first thing you should be doing is checking the foot for any abscesses, stone bruises, anything like that. So to check for digital pulses, this is the fetlock, and there's a bundle of vessels that runs down either side of the fetlock, so on the outside and on the inside. And if you're running your hands over it, you should feel it sort of blip back and forth between your fingers, on the inside and on the outside. And you want to just place your hands really lightly over that and feel for a pulse. So it's kind of like if you stub your toe on a table or anything like that, and your toe feels like it's throbbing for a while. It's the same with horses. If they have any pain in their feet from laminitis or a stone bruise or an abscess or anything like that, their foot pulses will throb. And so you should put your hand there and lightly feel if you can feel a pulse. In a normal horse, you should either not be able to feel a pulse at all or feel a really light pulse. If you feel a bounding pulse, that's a pretty good sign that there's something going on in the foot. You want to make sure not to press too hard, because if you press too hard, you can close off the vein and you won't feel the pulsing. The other thing to do is make sure to check for heat in the foot. So best place to feel for that is kind of around the front, but really anywhere along the hoof. Just compare it to the other foot, any of the other feet. They should all be about the same temperature. You shouldn't feel a heat difference in one foot or the other. Check down around the coronet band, so the split where the hair meets the hoof. See if there's any soft spots, see if there's any tender spots. It might be an abscess trying to burst out somewhere. So we're all good over here, and the heat in the foot is about the same. Next thing you want to do is pick up that foot. Make sure it's all nice and cleaned out. Once it's all cleaned out, you're looking at the bottom of your foot, so look at the bottom of the foot for any signs of soft spots, sore spots. If you've got hoof testers, you can go around and press around the foot like that. Make sure that the back side of the hoof tester is also on the hoof of the horse. You don't want to go up to the haired area because that will hurt. So you're just squeezing to see if there are any sensitive spots. And if there's any sensitive spots, it might tell you that there's, again, a stone bruise or an abscess or anything like that. Horses that have laminitis, sometimes they have a sore spot right here at the point of the frog, and you want to be checking for that, as well as checking the frog, making sure that nothing there is hurting. If you don't have hoof testers, which many of us might not at home at the moment, you can just use your fingers and press pretty hard and just see if there are any soft spots, or see if there's any spots on the hoof that look different than the others. Ideally, you'd be doing these without shoes on, because you can get soft spots underneath the shoe and abscesses trying to burst out under the shoe.